And so we have two groups of antigen on our red blood cell, AV antigen and D antigens. For the AB antigens, we are born with antibodies, which is found in our blood plasma, in our liquid part of blood. Clear? But D antigens, we don't born with that antibody against D because there is only one. So B or A antigens. If you are if your red blood cell has A antigens, then you don't need B antigens. That's why to protect from B, A blood group contain antibody against B, and B blood group contain antibody against A. That's why look here. So this is type A blood and type B blood. You see RBC? So on the red blood cell surface, you see this is triangular yellow antigen, that is A antigens. Type B, on the red blood cell, there is purple square antigens, just for depiction. That is type B blood group. So now, which antibodies this blood group will have? Antibodies are always against the antigens. It is simple, okay? So if you are A blood group, then to protect A from B, you will have antibodies against B. You see Y-shape antibodies against this square antigens. And then for B blood group, antibodies will be against A antigen. So you see against this triangular yellow antigens. Because if you mix these blood together, then what happens? Antibodies against B will bind with B antigens, and antibodies against A will bind with A antigen, and they clump. So my question is now here. We are either A blood group, B blood group, or AB blood group, or O blood group. So someone needs to answer your question now. If my blood group is AB, what are the antigens present on my red blood cell?
A and B.
A and B, good. If you have A and B antigens on my red blood cell, what kind of antibodies I can resist in my plasma?
You can't.
I cannot resist
no.
any. If I have A, that will kill my B. If I have B, anti-B, then that will kill my B. So I cannot have any antibodies in my plasma. My next question is now, if I am O blood group, which antigens are on my red blood cells?
None.
None.
Not A or B.
None A or none B. That means which antibodies can I carry in my plasma?
A
A and B.
B.
A and B, because I don't have any antigens. That's how we carry antigens and antibodies, okay? So let's see here. This is the transfusion reaction. So if you take different group of blood, if you are A blood group, which blood you can take during the emergency? Let's see, there is vehicle accident, you lost a lot of blood, came to the emergency room, and now you need transfusion of blood. So which blood group you want and why? Okay, so let's see, this is anti-B antibodies and there is anti-A antibodies. And here is the blood type A blood, type B blood, type AB blood. So let's see if I have type A blood and anti-B antibodies. These antibodies I carry. So there is no agglutination because there is no B blood group. This is A. That's how you see blood is like very smooth, no agglutination, no clumping. But if I am, here is, if I have a serum, which is anti-A, and I mix with A blood group, what happens? They clump. If I have type B blood group, and then I put anti-B, what happens? Again, clumping. But if I have type B blood group, but I put anti-A, which I carry to protect us from B, that's why there is no clumping. Now type AB, if you're type AB blood group, what happens? whether it is anti-B, which will bind with B antigen, anti-A will bind with A antigen. So in both cases, you will clump other bloods. Okay. So which blood group you going to take? So if somebody is type AB person, which antibodies this individual carry? None of them. They carry both antigens, but none of the antibodies. Yes. So this kind of type AB blood group are the universal recipient because they have no antibodies. So their antibodies will not bind with the foreign blood and kill the donor's blood. Otherwise, those red blood cells will not be functional because their antibodies will kill it. Okay, that's why AB blood group is universal recipient. They can take from any blood group, but not in large amount. Let's say if somebody is in road traffic accident, AB blood group, and needs like 5 pints of blood. Can you give them? Yes, you can, but problem will be not the recipients antibodies. Their recipients have, AB has no antibodies, but donor's blood will have antibodies, and donors large amount of antibodies will bind with recipient antigens and clump the blood. So large amount is not possible. You cannot give only a pint or two so that you can neutralize the antibodies of the donor and you can still sustain it. Okay. Whereas O blood group is universal donor. It can give anybody because it does not carry any antigens. Okay. Now another blood group is Rh factor, which is Rho antigens. Rho antigens is rhesus antigens, rhesus factor. You see, I have written here rhesus factor antigens. It is found on our red blood cell plasma membrane surface. First, this antigens was found in the rhesus monkey. That's why we call them Rho antigens. But you don't have antibodies against it because this is your and you are only one. So you don't need to protect from anyone else. That's why there is no antibodies. Okay. Now, let's see you are Rh positive and your partner is Rh negative. Before that, let me explain it. 85% of US population have Rh antigen. That means 85% of us are Rh positive. Only 15% do not carry these antigens. Clear? So, what happens in the case now? Let's see, there is a disease called erythroblastosis fetalis. Just follow me like a story. This erythroblastosis fetalis happens with the female who is Rh negative. Okay. So let's see if a female is Rh negative and the partner is Rh positive. Female get pregnant and the baby had chance 50-50. Either baby will be, fetus will be Rh positive or Rh negative. Clear? So if baby is Rh negative, which is compatible with the mother, no problem at all. But if baby is Rh positive, first term baby is Rh positive, the fetus is Rh positive, what will happen? That is not compatible with mother's antigens. But fetus is protected by placenta. So there is no mixing of blood from the fetus to the mother. Are you following me? If there is no mixing, that means during the birth, baby will come out healthy without any effect. That's why even with Rh negative female, Rh positive baby, or Rh negative baby. First pregnancy is safe. Okay. But during the childbirth, if it is vaginal, normal vaginal birth, or sometimes such kind of pregnancy get into miscarriage. There is abortion or miscarriage. And during that time, there is rupture of the placental blood vessels. And that makes some of the Rh positive baby blood with the mother's blood. So now what happens? Baby is out, baby is healthy, baby will survive. But Rh positive blood is in the female's body. Now what? Mother does not recognize Rh positive blood because mother has Rh negative. So that Rh positive blood for mother is like a foreign body. So now mother's white blood cell get active, the immune system, and start making antibodies against the Rh positive body. Rh positive antigens. And slowly build that immunoglobulins antibodies in the plasma of the mother, in the blood, mother's blood. So mother is already building it. Now, the same mother again get pregnant same second time with the same man, and by chance again the baby is positive. Now what happens? The fetus is positive second time, and mother has antibodies against Rh antigen already developed. Red blood cell cannot cross the blood placenta barrier and mix with the mother's blood, but immunoglobulin, which is made already, can cross the placenta and get inside the fetal blood. So what will happen? If antibodies formed, antibodies is coming to the mother's, from the mother into the fetus blood, they are binding and start killing the red blood cells inside the fetus body. And the fetus will be anemic even before he or she is born. Are you following me? And that is called hemolytic anemia of newborn or erythroblastosis fetalis. So what are the conditions for erythroblastosis fetalis? Mother must be Rh negative. Man must be Rh positive. First baby must be Rh positive. And it happens when the second baby is also Rh positive. So to protect from this, all these shaga, what do we do? When somebody female we find like Rh negative, we give the shot, which is called RhoGAM, before even she is pregnant. So it protects from any antibody formation. Or if she has not got it before, then within the 72 hours of childbirth or miscarriage or abortion or surgery, we give that RhoGAM and protect the female, the baby. Okay. So that is the erythroblastosis fetalis. So Rh factor is another type of antigen found on the RBC. This is very minimum information, but I have given you explanation there. Can cause problem when Rh negative mother and Rh positive baby at birth. Mother may be exposed to Rh positive blood of fetus. How they get exposed? Due to miscarriage, abortion, or surgery. In later pregnancy, mom produce Rh antibodies, and in hemolytic disease of the newborn, that is called erythroblastosis fetalis, Rh antibodies from mom cross placenta and combine with Rh antigen on fetal blood cell, causing hemolysis of the fetal red blood cells. And that is the anemia even you are born before. Okay. So that is the RBC. blood typing. Hemostasis is the cessation of bleeding. So once you cut, there is automatic mechanism in our blood which stops bleeding. Okay, and that is promoted by reaction initiated by vessel injury. So when blood vessel is cut, in the wall of blood vessel, there are 3 layers. Outermost is tunica externa, middle is tunica media, and then innermost is tunica intima, which is simple squamous epithelium with some collagen fibers under it. Okay, so when there is cut, collagen fiber exposed, and that start this the clotting reactions. Okay, so after that there is blood vessel constriction, and that reduce the blood flow. Then platelets comes, and platelets clump with each other and make the wave of platelets. Then fibrin comes, and fibrin makes it stronger. Okay, that is the function of the platelets. Okay, so let's see here. This is the blood vessel. As I said, this is the endothelial wall, the innermost layer. Here is the collagen fibers underneath the endothelium through the connective tissue. And here in the blood vessel, you have these platelets. These platelets, the platelets do not stick to intact endothelium. So if it is intact, the platelets are flowing in your blood. They don't stick here because of presence of these prostaglandin, PGI2 prostaglandin, and nitric oxide, NO. I have wrote it here. Nitric oxide, NO is nitric oxide, and prostaglandin is PGI2. So they prevent these platelets to attach here and keeps from forming the clot. Okay. So you see other thing here, CD90 cluster of differentiation protein on the endothelial cells, that is called CD39, is an enzyme, breaks down ADP in blood. So it breaks down, this one breaks down ADP into AMP, adenosine monophosphate. And otherwise, this ADP helps blocking the clumping the platelets. But if there is AMP, they prevent this clumping. Okay. Now you have a blood, the injury, like let's see, cut in the skin. Then what happens? You expose this endothelium and you expose the collagen fibers. So damage to endothelium allows platelets to bind to expose collagen. You see, expose collagen. And then see the blue dots, those are called von Willebrand factor. Blue dots, von Willebrand factor. Von Willebrand factor is a factor which stays between the collagen and the platelets and help them stick. Von Willebrand increased bond binding to both collagen and platelets. So this is like the glue between the collagen and the platelets. And then there is more ADP formed, and these ADP activates platelets, which is called platelets aggregation and platelet release reaction and the clump. Then later fibrin comes in and make it a stronger wave of platelets and seal the knee cut here. Okay, so you see there is further platelets, and then a lot of fibrin comes here and plug this platelets in the damaged site. Okay, so what is the role of fibrin? What does fibrin do? So it's like plugging at the beginning is very weight, and when fibrin comes, they make it stable, a stronger plug. Okay, so platelet plug becomes infiltrated by meshwork of fibrin. As you see here, fibrin, these are the fibrins. And clot now contains platelets, fibrin, and traps some of the RBC. And then this platelet goes contract and form more compact or strong plug. So this fibrin is not active all the time in our blood. Fibrin is found in the inactive form of fibrinogen. Okay. So how fibrinogen and fibrin is active during making the blood clot stronger? That occurs through the two pathways, intrinsic pathway and extrinsic pathway. Intrinsic pathway clots occurs either outside. If you have a blood, let's see, if you don't have anticoagulant in a beaker or in a test tube, and if you put blood, it will coagulate or clot, and that is called intrinsic pathway. Or if you have the damaged tissue and the collagen is exposed and then you form the clot, that is intrinsic pathway. Okay, so intrinsic pathway clot damage vessels and blood left in a test tube, either it is in test tube or in your damage to blood vessel. That is extrinsic pathway, and that is initiated by exposure of blood to negatively charged surface of glass or blood vessel collagen. So both glass surface and collagen in the blood vessel are negatively charged, and that stick platelets together. And then acts on other clotting factors, which are, we have from 1 to 12 clotting factors. You don't need to go in that detail. And also calcium and phosphate helps prothrombin to thrombin, and that thrombin converts the fibrinogen into fibrin, and then fibrin makes the plug stronger. Okay. On the other hand, extrinsic pathways damage outside blood vessel release. So it is outside, and that is activated by thromboplastin that triggers a clotting, and which is also common in the extrinsic pathway. So I will explain this complex mechanism. You don't need to go in detail of this. I'm just introducing you guys so you are familiar with this complex. Later you're going to understand. So here is diagram, and I'm going to talk about these mechanism again. So here is extrinsic pathway and intrinsic pathway. Let's talk about intrinsic pathway and then extrinsic pathway. And there are some gray area, which is common pathway, where both pathway involve in forming the clot in your body. So here, either it is glass or collagen, which are negative charge and other stuff that activates the platelets, and that activates clotting factor 12. Then activated 12 factor activates factor 11. Activated factor 11 activates factor 9, and then activated factor 9 makes the complex. You see, complex of 8 complex, 9 activated calcium phospholipids, they activate again them all, and these complex then go to the common pathway and activate factor 10. Activated factor 10 makes several other complex. This is such a complex mechanism inside our blood. And then ultimately they convert prothrombin protein into thrombin, and then thrombin convert inactive protein molecule, which is fibrinogen in your plasma, in fibrin, and that fibrin, which is the clotting factor 13, ultimately makes the big fibrin polymers, and that make a meshwork inside the platelets and make it stronger. Okay. Same thing with the extrinsic pathway, like thromboplastin in our plasma, and that activates factor 7, activated factor 7 complex. Again, they go the common pathway and follow the same route. Okay, so this is all about the blood clotting. For you guys, I want you guys to know the function of platelets in blood clotting and what is the role of the collagen fibers in damaged tissue, okay, and the platelets. Okay, you don't need to worry about these all details I have gone. I'm just giving you, these are the good to know things, not must to know things, because later in upper level class you will have in detail when you go to professional school. Okay, so let's go to now the new share. Okay, so now interesting chapter. This is blood, heart, and circulation. And here we're gonna, so we have done this blood part of chapter 13. Now we're gonna go in heart and circulation maybe in third lecture, which will have chapter 14, which will talk about a lot about the parameters of the heart function. Okay, so let's see here the structure of the heart. If you see here, because I am here in the lab, I want you guys to, I'm going to bring heart model and show you guys here. Okay, just a minute, give me a minute. Okay. Can you guys see this heart model?
No, your camera's not on.
Oh, really? Okay. So this is the heart model. Can you see it?
Yes.
Yes.
So heart has 4 chambers. 2 upper chambers you see here. Those are called atria. 2 lower chambers are called ventricles. This is right atrium, left atrium, right ventricle, left ventricle. And you see the great vessels. You see, this is superior vena cava, inferior vena cava, and there is aorta, and here is pulmonary trunk. Okay, so this is the heart structure, and there are 2 pairs of pulmonary veins on the back. Okay, now in the diagram you can see here, in the diagram you can see here, so this is the upper one, right atrium, left atrium, right ventricle, left ventricle. Atria receives blood, So right atrium receives blood from superior vena cava and inferior vena cava. And left atrium receives blood from one pair of left pulmonary vein, another pair of right pulmonary vein. So from right atrium, blood then pass to the valve that is called tricuspid valve, and then it comes to the right ventricle. From the right ventricle, then blood passes through another valve that is called pulmonary semilunar valve, and then it goes to pulmonary trunk, and through the right and left pulmonary artery, then it goes to right and left lungs. You see, this is blue blood. That means they are deoxygenated blood. They are poor in oxygen. Now, once it goes to your lungs, lungs deliver oxygen. So red blood cell unload carbon dioxide and upload oxygen. And then this venous blood then becomes red with rich in oxygen, oxidized red blood cell, oxyhemoglobin. And through the pulmonary vein, it brings to the left atrium from both sides of the lungs. Once it comes to the left atrium, then through the mitral valve, it goes to left ventricle, then through the aortic semilunar valve, through the aorta, all over the body. This is the upper part of the body, here lower part of the body. So this blood is now rich in oxygen, yes? So you see, artery, you know, each artery in body ultimately branches off and becomes capillaries. So now these capillaries is exchanging gases. Oxygen is leaving the capillaries and going to the cells, tissues, whereas carbon dioxide from the tissues is going to the capillaries. And then it becomes again superior and inferior vena cava and comes to the right atrium. Okay, so some of the terminology here: artery and veins. Artery and veins. Artery are the blood vessel which carry blood away from the heart, A for A. Whereas veins are the blood which brings blood towards the heart. All the arteries in the body carry oxygen-rich blood, except which artery?
Pulmonary artery.
Pulmonary.
Pulmonary
Pulmonary.
artery. All the veins in the body carry deoxygenated blood or oxygen-poor blood, except one vein.
Pulmonary vein.
Pulmonary
Pulmonary
vein.
vein.
So pulmonary vein and pulmonary artery is exception to the general artery and vein. Clear? If you see here, right side of the heart deals with deoxygenated blood, whereas left side of the heart deals with oxygenated blood. This apex of the heart is slightly in your left side of your thoracic cavity, and the size of the heart is like your fist size. Both pump, you see there are two pump system, right pump and left pump. Right pump is pumping to the lungs and left pump is pumping to the all over the body. So which pump needs to produce more force, you think, right or left?
Left.
Left, because left has to pump from the heart to the head up to the toe, whereas right has to pump only nearby to the lungs. That's why pressure in the pulmonary system is lower and pressure in the systemic circulation is higher. So blood flow from right atrium to the right ventricle. So from the right heart to the lungs and back to the heart is pulmonary circulation. And blood flow from the left heart to the body and back to the heart is systemic circulation. Systemic means it goes in all the system of the body. Okay. Okay. So between atria and ventricle is a layer of dense connective tissue that calls fibrous skeleton. Like your skeletal muscle is attached to the bones through the tendon, our heart muscle is attached to the fibrous skeleton lying in between the atria and ventricles. Myocardial cells, if you remember the histology of myocardial cells, they are branched and they are attached to each other by intercalated disc, and that allows flow of sodium, potassium ions easily across that gap. And that's why each and every cells in the heart act like a syncytium, because if you poke one cell, electrical impulse will spread all over the heart. So they act like one unit. So here again, the blood coming from tissues. I explained this. So superior vena cava, inferior vena cava, and then going all over the body. Okay, same thing. Okay, so now pulmonary circulation and systemic circulation. Pulmonary circulation is you will start from here, right side, go to the lungs, come back to the heart. This circuit from the heart to the heart is, this circuit is pulmonary circuit. From the left atrium, go to the body and back to the heart is systemic circuit. So pulmonary circulation is path of blood from right ventricle through the lungs and back to the heart, left ventricle. Systemic circulation is path of blood from left ventricle to the body and back to the heart. So because this left ventricle pumps blood with more force, if you compare, in this diagram it does not show, but in real heart dissection, when you see in animals or human heart, this wall is the way thicker than the right ventricle. Okay. Now the valves in the heart. So resistance in the systemic circuit is more than the pulmonary circuit, because work done by left ventricle pumping to systemic circulation is around 5 to 7 times greater. That's why they are 3 to 4 times more muscular, thicker. Which one is thicker? Left ventricle wall. Now the valves in the heart. So there are 2 atrioventricular valves, which are the valve between the atria and ventricle. So valves between the atria and ventricles are tricuspid valve and bicuspid valve, and valves between the great vessels and the ventricles are semilunar valves. Okay. So here, if you cut the heart at the level of the valves, then you're going to see the valves here. So this is bicuspid valve. You see, it is only 2 cusp. That's why we call them bicuspid valve. This valve is also called, it has another name. What is that?
Mitral.
Mitral valve. And in the right atrioventricular valve is called tricuspid valve into the right ventricle. And then pulmonary semilunar valve or semilunar. Semi means half, lunar means moon. So they are like half moon shape. That's why we call them semilunar valve. If you look here, these valves look like the Mercedes-Benz sign. The Mercedes car sign, it looks like that. Okay. So that is pulmonary semilunar valve. So what is the purpose of these valves in the heart? These valves make sure blood is flowing in one-way traffic. Okay, one-way traffic. So pulmonary valve prevent backflow from pulmonary artery into the right ventricle. Aortic valve prevent backflow from aorta into the left ventricle. Tricuspid valve prevent backflow from right ventricle into the right atrium. And bicuspid valve prevents backflow from left ventricle into the left atrium. Okay. So that is, I think, for today. We have to start the lab. So cardiac cycle and heart sound, we're going to talk about that later. Okay. Thank you, guys. And
Thank
see
you.
Thank you, Professor.
you for the office hour today.
Thanks, Dr. Shaw.
Thank you, Dr. Shaw.
Bye.
Thank you,
Bye-bye.
Dr. Shaw.
Bye-bye.
Thank you, Professor.
Thank you.
Thank you. No, guys, you guys have to, whatever lab you have time, please come that time today, okay?